all, welcome back to my channel. It's your girl Nurse Lee, and on my channel I talk about nursing, beauty, and lifestyle. So if you haven't already hit that subscribe button, please do so right now and turn on your post notifications so that you'll be notified each and every time I post a new video. So for those of you who do not already know, I am a med-surg nurse. I've been a med-surg nurse for about a year now, and I've been working at a hospital on a med-surg unit. I just celebrated my 1-year anniversary as a new grad nurse this past October, and I'm so excited that I have reached that 1-year mark. Now, I don't know if I'm still considered a new grad nurse or not, but I do have some experience under my belt now. So in this video, I'm going to be sharing with you guys some tips and advice that I've learned over the course of the year. I feel like I've learned a lot, or I've learned enough to let you guys know what to do, you know, if you decide to start off as a med-surg nurse, like when you graduate nursing school and you pass your NCLEX exam and you decide that you want to start off on a med-surg unit, then this video is great for you to keep watching, because I'm going to be giving you guys advice, you know, on what to do as starting off as a new grad med-surg nurse. So if you're interested, just keep watching this video. So I'm going to be giving you guys about 4 tips and or advice, however you want to take it, on what to do as a new grad med-surg nurse, just to get you on the right path. Because starting off as a new grad nurse, you know, it can be difficult because you have to find your balance. You have to find your organization, your time management. Like, there's a lot to consider to put yourself on track. So I'm going to be sharing with you guys what I've learned so far. So the first tip I want to tell you guys is to know your facility's admission and discharge policy. If your facility has a specific way they admit patients and discharge patients, I would advise that you learn it so that the process can be smoother and quicker when it's time for you to take on patients, take on admissions, and do discharges. So on my unit, on my med-surg unit where I work, there is a set way that we admit patients, and there's a set way how we discharge patients as well. So when we're admitting patients, we obviously we have to get rapport, but before we get rapport, we're looking up the patient, and we're seeing if there's any like abnormality going on with the patient, whereas though the patient is not fit for the unit. So we're looking that up to make sure, you know, am I able to handle this patient? Is this patient fit for the unit, or does this patient need a higher level of care? So that's what we're doing. We're looking at the patient, and then obviously we're calling for report. So we get the report on our patient. Once the patient arrives on the unit, we do what we call admission intake questions. So we're orienting the patient to the unit, to the room, and then we're asking them admission intake questions. And in the system I use, I don't know if you guys have heard of Epic, but the Epic system that we use at my hospital, they have the admission questions already listed out in the system. So we're just going through it and asking them those questions. And it goes from there. We get vital signs, get the patient's weight, and look at the orders to make sure to know which orders we need to fulfill for the patient as soon as they arrive on the unit. Just like I said, we just follow the orders until the doctor comes and sees the patient, and then we go from there. So that's pretty much, to sum it up, how we do our admission process on my unit. I may be forgetting a few things just because I'm trying to remember things off the top of my head. But yeah, know your facility's admission process, so that when you have that down packed, then your admissions will go smoother. You'll be able to handle your patients better. Your discharge process, same way, know how it is. my discharge process. Sometimes we give discharge instructions. Sometimes the doctor gives the discharge instruction. It just depends on the medical team the patient is on. And we just follow the discharge instructions, make sure the patient is ready to be discharged, make sure they have a ride, make sure they don't have any questions. If they have any questions, if you're able to answer it, or just get the doctor to answer it. So just know your admission and discharge process. And another tip I want to tell you guys is to get a good report sheet. It's important to have a good report sheet so that when you are getting report and giving report, everything flows smoothly. Luckily for me, on my unit, we have Cardex sheets. So, and I really like the Cardex sheets we have on my unit because it's just very easy to follow. So if you have a good report sheet, a Cardex sheet on your unit, try to utilize it to help you stay organized, to take your report down and also to give report. And if you don't have one on your unit, then there's a lot online. You can Google Cardex report sheets and you can print you out a good report sheet so that you can stay organized when you're getting a report. That's very important. Getting report, being organized, letting everything flow, so that you better understand your patient, or so that you give a good report to another nurse is very important. So yeah, having a good report sheet just helps you to plug the patient's information in, and it's easy to navigate through, and it just is very helpful. Like I said, it just keeps you organized. So utilize your report sheets, y'all. Don't try to make things more difficult than they need to be. Tip number 3, I believe we're on, that I want to share with you guys is to build a good rapport with your nursing assistants. Yep, it is very important to build a good rapport with your nursing assistants because at the end of the day, they're very, very helpful. It's not about bossing them around and telling them what to do because you're the nurse and they're the nursing assistant. That's not how it should work. It's all about working together as a team to better care for your patient. So build a good rapport with your nursing assistants and work with them. I mean, not every nursing assistant is easy to work with. I mean, from my experience, I can speak on my experience because a lot of the nursing assistants on my unit, they're older than me, and it's like a barrier because they're like, okay, you know, how is she going to tell me what to do, or how is she going to tell me how to do my job type of thing. And it's like, I'm not telling you what to do. I'm not telling you how to do your job or anything. I'm just letting you know, how we can work better together to get to better care for our patients. So it's all in how you deliver the message. It's all in how you communicate with them. Like I said in the beginning of my journey, it was a little bumpy because when I would ask them to help me with something, it would either take a while for them to get it done, or it would be like, there'd just be a lot of complaining, and it's just like, come on, let's just get it done. So, but like I said, throughout my 1 year, I built that rapport with them, and it's like, they've seen how I do my job, they see how I work, and they see, that, she's a good nurse, because they analyze those things. They analyze that, right, let's see what kind of nurse she's going to be. So they, we built that trust with each other, whereas though, okay, hey, so-and-so, can you help me with this while I go and do X, Y, Z? So it's like, okay, she is busy. They see that you're busy. They need your help, so they're more willing to help you. But if you tell them to do something and then like you go sit down behind a computer or whatever, they're more reluctant to help you. So try to work together, try to know how to speak to them and communicate with them, because they're very helpful. Like I said, in the long run, they're very helpful. If there's something you can't get to and you ask your nursing assistant to help you out in the kindest way possible, just be very kind, be very nice to them. 9 times out of 10, they'll help you out. So at least in my experience, They're very helpful to me. And we just get it done, you know, just get it done. As a new grad nurse, 9 times out of 10, they have been on the unit longer than you. They've been working on the unit longer than you. So don't feel as though you cannot learn from your techs. If you feel as though, oh, I'm a nurse, they're a tech, I know more, that's not going to really get you anywhere. You have to keep in mind that you're the new grad nurse. They've been on the unit longer than you, so you can learn a lot from them as well. You know, you guys can learn from each other. It's not just, you know, I know more, I have a higher degree. No, you can learn from your techs. I know that I have learned from my techs as well. Like, I've learned from them. Like, it's certain things, it's like, okay, how do you want me to dress this bed up? Can you help me put an IV in this patient? You know what I mean? Like, there are techs on my unit who are experts at putting in IVs. And I'm still like, oh my gosh, like, how did you do that so quick? Like, I was struggling with that vein over there. How were you able to get it so quickly? You know, because they had that experience with blood draws, with putting in IVs. So don't hesitate to learn from your techs. At the end of the day, just give your techs clear, kind, direct instructions on how you need them to help you out. And when they help you out, show your gratitude. Show that you are grateful. Show that you are thankful. Really thank them. And show that you appreciate their help, because I've been saying this, they're very helpful. And if they're overwhelmed with something, you can help them out as well. If they can't get to something that you've asked them to do, don't wait for them to do it. Jump in, help them out. And then you can probably have a conversation later to see why they weren't able to get to it. But if you see your techs are overwhelmed, jump in and help them out. So the last tip I have for you guys is I encourage you to pay attention to the kind of patients that you get on your unit. Whether you get cardiac patients mainly, GI patients mainly, or COPD patients, or heart failure patients, kidney disease patients. Pay attention to the type of patients you get on your unit, because you want to study those common disease processes. You want to study those common disease processes because it's going to be helpful to you in the long run. If you're mainly getting heart failure patients, if you're mainly getting COPD patients, go home and just look up the pathology of COPD. Know how it works. Navigate through how, a patient with COPD presents, so that when you continue to get those patients, you will know how to treat and care for those patients. If you learn the pathology of the disease processes, then you will better understand your patient. You will better know how to care for your patients. That's one thing that I, even till today, really try to do, is like look up the diseases of my patients, so that if I get another patient who has the same disease processes, then it's not, it won't be difficult for me to understand how to care for my patients. So I strongly encourage you to read up on your patient's disease processes, so that you will understand more in depth on how to care for your patients, and critically think through how to treat and care for your patients. So that is something I still do to this day, and I'm working on doing that as well. It's not always easy, after working a 12-hour shift, to go home and read up on disease processes, but it can be done, and I encourage you guys to do it so that it can help you out in the long run. So that's all the tips that I have for new grad med-surg nurses. I'm really tailoring this to med-surg nurses because I'm a med-surg nurse, and this is what I've learned on my unit. This is what has helped me on my med-surg unit. So if you found this video helpful, please give it a thumbs up. Leave any comments down below. If you have any questions, comments, or concerns, leave it down below. Don't forget to hit that subscribe button. Thank you so much for joining Nurse Lee, and I'll see you all in my next video. Bye.